Hello, friends. I'm Dr. Sarah Mitchell, a urologist and bladder health specialist. Today, I want to talk about something many people experience but rarely question: waking up around 3 a.m. to urinate. Most people assume this is just part of getting older. They ignore it, adjust their sleep, and move on. But in many cases, this nightly awakening is not random and not harmless. It can be your body's way of signaling that something deeper needs attention. Over nearly 2 decades of clinical practice, I've seen this pattern repeatedly. Patients come in exhausted, frustrated, and confused. They tell me their sleep is broken every night at almost the same time. They feel drained during the day, struggle with focus, and sense that something isn't right, but no one has ever explained why it keeps happening. Here's what's important to understand. Consistent nighttime urination, especially around the same hour, can be linked to changes in fluid regulation, hormone balance, kidney function, cardiovascular health, and sleep-wake rhythms. When these systems are under strain, the body often speaks through disrupted sleep long before more serious symptoms appear. Before we continue, I'd love to know, where are you watching from today? Share your city or state in the comments. And if you found strategies that helped improve your sleep or nighttime bladder symptoms, feel free to share. Your experience may help someone else feel less alone and more informed. The medical reality: why 3 matters. Let's start with the medical reality that changes everything. Waking up at 3 a.m. to urinate is not a random inconvenience. It is a specific physiological signal that reveals critical information about 5 major body systems that may be malfunctioning right now without you realizing it. But as with all aspects of diagnostic medicine, understanding the specific mechanisms, recognizing the patterns, and knowing when nighttime urination signals danger versus normal variation is absolutely crucial. Generic advice about avoiding fluids before bed completely misses the serious health warnings your body may be sending. So, let's start with the fundamental physiology. What is really happening in your body at 3 a.m. that forces you awake to urinate? What are the 5 critical health issues that manifest specifically through nighttime urination? Why does it happen at the same time every night? And most crucially, what should you do immediately if your body is showing these warning patterns? We need to start with the circadian reality that most doctors never explain completely. Why does your body wake you specifically around 3 a.m. instead of 1 a.m. or 5 a.m.? It is not random. It is connected to your circadian hormone cycles and reveals specific information about what is malfunctioning. Between 2 a.m. and 4 a.m., your body experiences a natural dip in a specific hormone called antidiuretic hormone, or ADH. This is the hormone that tells your kidneys to concentrate urine and produce less of it during sleep. Think of this hormone as a dam. When you are sleeping, the dam should be closed, holding back the water so you can rest. If you are waking up during this specific window, it means your ADH production is compromised. That dam is breaking when it shouldn't. This can signal serious underlying health issues. Warning signal 1. The volume warning. Let's talk about critical warning number 1. This is what happens when you wake at 3 a.m. with a large volume of urine. If you wake up and produce a large amount of urine, and that urine is pale or almost clear, this signals failing ADH production. This can indicate early diabetes, pituitary dysfunction, or cardiovascular problems that are just beginning to manifest. The science shows that when you produce more than 300 milliliters of urine during a nighttime awakening, that is about the size of a standard soda can, your body is telling you that your hormonal regulation is breaking down. This isn't aging. This is your endocrine system struggling. If you are producing large volumes of diluted urine, your body is screaming that it cannot concentrate urine properly anymore. This requires immediate medical evaluation because it is an early warning of metabolic dysfunction. It means your brain and your kidneys are no longer communicating correctly to keep you asleep. Warning signal 2. The urgency trap. Now let's look at critical warning number 2. This is when you wake at 3 a.m. with a small volume of urine, but you feel a very urgent sensation. This signals overactive bladder or prostate issues that are progressing and will only worsen without intervention. When you wake up feeling a desperate urgency, like you are going to burst, but when you get to the bathroom you produce very little urine, perhaps less than half a cup, your body is telling you something specific. It is telling you that your bladder muscles are hyperactive, or your prostate is beginning to obstruct the flow. This pattern is especially common in men over 50. It is often the first sign of prostate enlargement that will progressively worsen. Think of your urethra like a garden hose. If you step on the hose, the pressure builds up behind the blockage, but the flow is weak. Your bladder has to push harder and harder against that blockage. Eventually, the bladder muscle gets irritated and twitchy. It starts sending full signals to your brain even when it is almost empty. The research shows that men who ignore this early warning typically develop severe urinary problems within 3 to 5 years. These problems can eventually require medication or surgery. Your body is giving you a chance to intervene now before it becomes a medical emergency. Warning signal 3. The metabolic alarm. Critical warning number 3 involves waking at 3 a.m. with accompanying symptoms like dry mouth, excessive thirst, or fatigue. This signals blood sugar dysregulation. It could be prediabetes or full diabetes developing silently. Here's the science behind this. At 3 a.m., your body is experiencing its lowest insulin sensitivity of the night. If you have undiagnosed high blood sugar, that sugar is floating in your bloodstream, damaging your nerves and blood vessels. Your body senses this danger and tries to save you. It forces your kidneys to filter that excess sugar out of your blood and dump it into your urine. But here is the catch. To get rid of the sugar, your kidneys need water to flush it out. So your body pulls water from your cells, your muscles, and your saliva to create urine. This is why you wake up feeling thirsty with a dry mouth. If you are waking up thirsty and needing to urinate, your body is telling you that your blood sugar regulation has failed. This is urgent because it means you are at the stage where permanent damage to your kidneys, nerves, and blood vessels is beginning. The 3 a.m. awakening is literally your body's last warning before serious complications develop. Warning signal 4. The stress spike. Critical warning number 4 is when you wake at 3 a.m. and have difficulty returning to sleep. This signals cortisol dysregulation. It indicates that chronic stress is destroying your hormonal balance and accelerating aging. When you wake to urinate and then lie awake for 30 minutes or more, unable to return to sleep, your body is telling you that your cortisol is spiking at the wrong time. Cortisol is your stress hormone. Normally, it should be low at night to let you rest. It should only rise in the morning to wake you up. But if you are under chronic stress, your adrenal system gets confused. It releases a surge of cortisol at 3 a.m. This jolts you awake. You might think you woke up because you had to pee, but actually the stress hormone woke you up first. The need to pee was just secondary. This cortisol surge is a sign that your adrenal system is exhausted and your stress response has become dysfunctional. Research shows that people with this pattern have a 340% higher risk of cardiovascular events within 10 years. Your body is warning you that chronic stress is literally killing you through hormonal disruption. Warning signal 5. The gravity effect. Finally, critical warning number 5. This is waking at 3 a.m. with leg swelling or shortness of breath. This signals heart failure or kidney disease that is progressing and requires immediate medical attention. If you notice that your legs or ankles are swollen in the evening and then you wake up multiple times to urinate, your body is telling you a story about your heart. It is saying that your heart isn't pumping effectively during the day. Gravity pulls fluid down into your legs and feet because the heart is too weak to pump it back up. Then, when you lie down to sleep, gravity is no longer an issue. All that fluid in your legs rushes back into your bloodstream. Your kidneys suddenly see all this extra fluid and go into overdrive to process it. This fills your bladder repeatedly throughout the night. This is a medical emergency pattern that many people ignore for years until they have a cardiac event. The 3 a.m. urination combined with swelling is your body's desperate cry for help before heart failure becomes severe. A real-life case study. Let me give you a specific example that illustrates these warning signals. A 56-year-old patient came to my office completely exhausted because he had been waking up at 3 a.m. to urinate for 2 years. He said to me, "Dr. Mitchell, I just assumed this was normal aging and tried to live with it." His pattern was alarming. He had large volumes of diluted urine, returning thirst, and difficulty getting back to sleep. These 3 factors together screamed metabolic dysfunction to me. But his previous doctor had simply told him to drink less water before bed. I ordered comprehensive testing, including fasting glucose, kidney function, and hormonal panels. The results were shocking. He was pre-diabetic, he had early kidney dysfunction, and his cortisol rhythm was completely disrupted. His body had been screaming warnings at him for 2 years through that 3 a.m. awakening, but no one had taught him how to decode the message. We immediately implemented a protocol addressing his blood sugar, stress levels, and kidney function. The results were extraordinary. Within 6 weeks, he was sleeping through most nights. Within 3 months, his blood sugar markers had dropped to healthy levels. His kidney function improved and his energy returned completely. Within 6 months, his risk factors for diabetes and cardiovascular disease had decreased dramatically. His transformation came from finally understanding what his body had been desperately trying to tell him every single night at 3 a.m. This story isn't unique. I have seen hundreds of patients whose 3 a.m. awakenings were early warnings of serious health problems that were completely reversible when caught early. Diagnostic protocols: how to check yourself now. Let's talk about what you can do. Here are the diagnostic protocols for decoding your body's 3 a.m. message. Protocol number 1 is to track your pattern for 1 week. Keep a notebook by your bed. Note the exact time you wake. Note the volume of urine. Was it a little or a lot? Note the color. Was it clear, pale, or concentrated dark yellow? Note any associated symptoms like thirst, dry mouth, or difficulty returning to sleep. And note how you feel the next day. This data reveals whether your pattern signals hormonal, metabolic, cardiovascular, or urological problems. Protocol number 2 is the volume test. Measure your nighttime urine volume for 3 consecutive nights. You can use a simple measuring cup or marked jar. If you are producing more than 900 milliliters total per night, your body is telling you that something is seriously wrong with your ADH production or kidney concentration ability. This requires immediate medical evaluation because it indicates your body has lost the ability to conserve water during sleep. Protocol number 3 is to assess the associated symptoms that reveal what system is failing. Remember the code: thirst and dry mouth equals blood sugar problems. Swelling in the ankles equals heart or kidney issues. Difficulty returning to sleep equals cortisol and stress dysfunction. Urgency with small volume equals prostate or bladder problems. Your body gives you multiple clues if you know how to read them. Protocol number 4 is to get comprehensive testing based on your pattern. This isn't just a simple urine test. You need to ask your doctor for fasting glucose and HbA1c to check for diabetes. You need to check kidney function. For men, you need to check prostate markers. You need hormonal panels and potentially a cardiac evaluation if swelling is present. The 3 a.m. awakening is your body's way of forcing you to pay attention before silent diseases become medical emergencies. Immediate interventions. You can start today. Now, let's discuss the immediate interventions based on what your body is telling you. Intervention number 1 is for the large volume, diluted urine pattern. This is the metabolic warning. You must immediately reduce sugar and refined carbohydrates in your diet, especially in the evening. Increase protein and healthy fats. And get urgent metabolic testing. Your body is warning you that insulin resistance or diabetes is developing. This is reversible now, but may not be if you wait. Intervention number 2 is for the small volume, urgent pattern. This is the prostate or bladder warning. You should begin pelvic floor exercises. For men, these are often called Kegels. You must reduce bladder irritants like caffeine, alcohol, and spicy foods, particularly after 4 p.m., and get a urological evaluation. Your body is telling you that structural or muscular problems are developing that will progressively worsen without intervention. Intervention number 3 is for the thirst and dry mouth pattern. This is the blood sugar warning. Get immediate blood sugar testing. Implement a low glycemic diet. This means eating foods that do not cause rapid spikes in your blood sugar. Also, consider whether medications you are taking might be affecting your blood sugar. Your body is literally telling you that you are developing diabetes. This is urgent. Intervention number 4 is for the difficulty returning to sleep pattern. This is the stress hormone warning. You need to implement stress management techniques immediately. Try breathing exercises before bed. Evaluate your work-life balance. Consider adrenal support. Your body is warning you that chronic stress is destroying your hormonal balance and accelerating disease development. Intervention number 5 is for the swelling and shortness of breath pattern. This is the cardiac and kidney warning. This requires immediate medical evaluation. Do not wait. Elevate your legs in the evening to help fluid drain before you go to sleep. But most importantly, see a doctor. Your body is telling you that heart or kidney function is compromised, and you are at risk for serious complications. Do not delay on this pattern. It is a medical emergency that has been developing slowly. My medical recommendation is urgent. Do not dismiss nighttime urination as normal aging or a minor inconvenience. Your body is using this uncomfortable symptom to force your attention on health problems that are developing silently and can still be addressed before they become life-threatening. Track your pattern, understand what your specific symptoms mean, and get appropriate medical evaluation based on the warnings your body is sending. The 3 a.m. awakening is not your enemy. It is your body's desperate attempt to save your life. Natural support for recovery. Before we close, I want to mention something crucial for people who are decoding their body's 3 a.m. messages, but want to ensure they are supporting their entire urinary and metabolic systems while addressing underlying health issues. Understanding what your body is telling you is essential, but the recovery process can be significantly optimized with specific nutritional support. We want to address the root causes of nighttime urination while supporting kidney, bladder, and metabolic health. That is why I recommend two natural support options that perfectly complement the diagnostic and intervention protocols we have discussed. For people who want gentle support while implementing these health improvements, I recommend organic watermelon extract. This is rich in a natural compound called L-citrulline. It helps improve circulation specifically to the kidneys and bladder. It supports healthy kidney function and helps optimize the systems that may be causing your nighttime awakenings. It acts gently to relax the blood vessels and ensure the urinary tract is working efficiently. But if you are looking for comprehensive support, if you want to not just address symptoms but also optimize kidney function, support healthy blood sugar, improve bladder control, and accelerate recovery from the underlying issues, then I recommend an advanced nighttime bladder support formula. When looking for a formula like this, you want a specific combination of ingredients. I recommend finding a blend that includes icarian from horny goat weed, which improves circulation to the urinary organs. You want tonkat ali, which helps with hormonal balance and supports healthy ADH production. You want fenugreek, which is excellent for blood sugar support and metabolic health. You want nettle root, which provides comprehensive urinary system support and helps with natural fluid balance. And you want concentrated L-citrulline for optimal kidney and bladder circulation. Together, these ingredients create the perfect nutritional foundation. They address the root causes of nighttime urination while supporting your body's healing from whatever underlying issues are causing your 3 a.m. awakenings. For your convenience, I have located the best options for these specific formulations. You will find both options linked in the pinned comment and the video description below. Please listen to what your body is telling you at 3 a.m. Take action on the warnings it is sending. That nighttime awakening isn't a nuisance. It is your body's way of potentially saving your life by forcing you to address health problems while they are still reversible. For persistent symptoms, always consult a professional. I am Dr. Sarah Mitchell, and I wish you good health and restful nights. Thank you for listening.